Hello, I'm Dr. Carolyn Richardson, and this is Tips After the Visit, videos with information that has been helpful to my patients and their parents. You might find this information useful also. Check with your child's pediatrician or medical care provider to make sure that this information is right for you and your child. Today's topic is giving breathing treatments to an infant or a young toddler. Some parents brought in their 8-month-old child because the child had had a really bad night. The child had been wheezing and coughing and struggling to breathe, and the parents brought the child in because they were concerned about her level of respiratory distress. I assessed the child to make sure that her oxygen level was within the normal range, and it was. And I agreed that the child did indeed need a breathing treatment. At that point, the father said, "Oh no, can you please just give her some kind of liquid to drink? She doesn't like those breathing treatments. She cries, and I think the mist is burning her eyes." I explained to the father that the child was frightened because she was struggling to breathe. I even opened the top of her pajamas so they could see her chest heaving up and down as she struggled to breathe. I explained to the father that she needed to breathe in this medicine that would then get in and relax the muscles in her airway, let her get better oxygen, and then her distress would dissipate. I also explained that the mist does not burn the child's eyes or irritate the child's eyes. The parents agreed to let the child receive the breathing treatment. So the nurse prepared it and I administered it to the child. I was able to distract the child to get her to breathe in some of the medicine. You could see that with each breath of the medicine, her struggle to breathe decreased. The parents were amazed. The father admitted, we weren't giving the medicine the way you were. We weren't holding the mask close enough to her face so that she was able to breathe in the medicine. I explained to the father that when the children are frightened, and older children even think that the mist is hot, and that's why they back away from it. So explain to the child that the mist is not hot, that this is medication that will help them feel better. You have to remember, the child is struggling to breathe. You're trying to cover the child's face with a mask. The child's probably thinking, "What are you doing? I already can't breathe, and now you're trying to smother me?" Once the parents understood how to properly administer the medication, they would be able to help their child. A word of caution. If your child is getting a breathing treatment and continues to struggle to breathe after the treatment has finished, or if the child has a fever or any other sign of serious illness, your child needs urgent, if not emergency, medical attention. Well, that's all for now. Check weekly for new tips after the visit. Thank you.